the foundation of care-effective communication. This is by The World of Work and narrated by Dr. Mirofora Georgiou for WOW Home Care employees. Effective communication is paramount in adult social care. It is the key to building strong relationships and ensuring that everyone involved feels understood and valued. It forms the bedrock of trust and understanding between care workers, individuals receiving care, and their families. Without it, misunderstandings and frustrations can easily arise. Clear communication ensures that care plans are tailored to individual needs and preferences. This personalization is crucial for providing high-quality care. It allows care workers to understand and respond to the physical, emotional, and social needs of those they support. This holistic approach is what makes care truly effective. Imagine a care worker who can clearly explain a medication schedule to a person with dementia, alleviating their anxiety. This clarity can make a world of difference. Or a care worker who can patiently listen to a resident's concerns about their living situation, making them feel heard and respected. This active listening builds trust. These are just two examples of how effective communication transforms care from a series of tasks into a compassionate and person-centered experience. It turns routine interactions into meaningful connections. Effective communication is not just about conveying information. It's about fostering genuine connections. These connections are the heart of quality care. When care workers communicate with empathy and respect, they create a safe and supportive environment where individuals feel valued and empowered. This environment is essential for well-being. This, in turn, contributes to their overall well-being and quality of life. Effective communication is the cornerstone of compassionate care. Speaking the language of care. Communication methods. Communication in adult social care goes beyond spoken words. It is a multifaceted process that involves understanding and empathy. It encompasses a range of methods that cater to diverse needs and preferences. These methods ensure that every individual feels heard and understood. Verbal communication, while essential, is just one piece of the puzzle. It is often complemented by other forms of interaction. Non-verbal cues, such as facial expressions, body language, and tone of voice, speak volumes and can either reinforce or contradict spoken messages. These subtle signals are crucial in conveying emotions and intentions. Written communication, including care plans, progress notes, and letters, provides a formal record of care and ensures continuity. It is essential for maintaining accurate and detailed records. Digital methods, such as email, text messaging, and video calls, are increasingly important for connecting with individuals remotely, sharing information quickly, and facilitating communication with families. These tools have become indispensable in modern care settings. Each method has its strengths and limitations, and the most effective approach often involves a combination. By integrating various methods, caregivers can provide more comprehensive and personalized care. For instance, explaining a new care routine verbally while providing written instructions can reinforce understanding. This dual approach helps ensure that the information is clear and retained. Similarly, using video calls to connect with family members can supplement in-person visits and provide emotional support. These virtual interactions can be a lifeline for those who are unable to visit frequently. Building bridges. Positive relationships through communication. Positive relationships are the cornerstone of quality care. Open and honest communication is essential for building trust and rapport between care workers and those they support. Active listening empathy, and respect are crucial for fostering meaningful connections. For example, taking the time to listen to a resident's life story shows that you value them as an individual, not just as someone who needs care. Similarly, acknowledging a colleague's hard work and offering support can foster a positive team environment. Clear communication about roles, responsibilities, and expectations is also vital for preventing misunderstandings and conflict. Regular team meetings and supervision sessions provide opportunities to discuss challenges, share best practices, and strengthen communication within the care team. Understanding unique needs. Individualized communication. Every individual has unique communication needs and preferences. These can be influenced by factors such as age, culture, language, sensory impairments, and cognitive abilities. Effective care requires taking the time to understand and adapt to these individual needs. This process begins with a comprehensive assessment of the individual's communication abilities and preferences. What are their preferred methods of communication? Are there any sensory impairments, such as hearing loss or visual impairment, that need to be considered? Do they have any cognitive impairments that might affect their understanding? Once these needs are identified, care plans can be tailored to ensure that communication is clear, accessible, and respectful. Section 5. Bridging the gaps. Communication aids and technology. Communication aids and assistive technologies play a vital role in facilitating communication for individuals with disabilities or impairments. These tools can bridge communication gaps and empower individuals to express themselves, participate in their care, and maintain their independence. Communication aids encompass a wide range of tools, from low-tech options like picture cards and communication boards to high-tech solutions like speech-generating devices and eye-tracking technology. The choice of aid depends on the individual's specific needs and abilities. For example, someone with limited speech might use a communication board with pictures or symbols to communicate their needs, while someone with a visual impairment might benefit from a screen reader that reads text aloud. Section 6. Digital connections. Technology and social care communication. Digital technologies are transforming the landscape of communication in adult social care. From video conferencing platforms that bridge geographical distances to telehealth services that provide remote consultations, technology is enhancing accessibility, convenience, and quality of care. For individuals receiving care, digital tools can empower them to connect with loved ones, access information and entertainment, and participate in online communities. For care workers, these tools can streamline communication with colleagues, families, and healthcare providers, facilitating timely interventions and informed decision-making. However, it's crucial to ensure that digital technologies are used ethically and responsibly, respecting individual privacy and data security. Section 7. Breaking down barriers. Ensuring clear communication. Despite best efforts, communication barriers can arise in adult social care settings. These barriers can stem from various factors, including language differences, cultural differences, sensory impairments, cognitive impairments, environmental distractions, and emotional factors. Overcoming these barriers requires a proactive and empathetic approach. Strategies for promoting effective communication include using clear and simple language, avoiding jargon, checking for understanding, being patient and attentive, using visual aids when appropriate, minimizing distractions, and creating a welcoming and non-judgmental atmosphere. It's also crucial to be mindful of cultural differences in communication styles and adapt accordingly. For example, some cultures may value direct communication, while others may prefer a more indirect approach. Section 8. Seeking guidance. Resources for effective communication. Numerous resources are available to support care workers in developing and enhancing their communication skills. These resources can provide valuable information, training, and guidance on various aspects of communication in adult social care. Professional organizations, such as the Royal College of Nursing and Skills for Care, offer training courses and resources on communication skills, including specific guidance on communicating with individuals with dementia, learning disabilities, and other conditions. Online platforms provide access to webinars, articles, and forums where care workers can connect with peers, share experiences, and learn from experts. Healthperts. Additionally, local libraries and community centers often offer workshops and support groups related to communication and caregiving. Section 9. Respecting privacy. Confidentiality in care. Confidentiality is a fundamental principle in adult social care, underpinned by legislation such as the General Data Protection Regulation, or GDPR, and the Human Rights Act. These laws ensure that personal data is handled with the utmost care and respect. Respecting confidentiality means protecting the privacy and dignity of individuals receiving care by ensuring that their personal information is handled sensitively and securely. This involves not only physical security measures, but also digital safeguards. This includes information about their care needs, medical history, personal life, and any other sensitive information shared in confidence. Such information must be stored and shared only with those who have a legitimate need to know. Care workers have a legal and ethical obligation to protect this information from unauthorized access, disclosure, or use. This means implementing strict protocols and being vigilant about potential breaches. Confidentiality is not just about protecting information, it's about building trust. Trust is the cornerstone of any effective care relationship. When individuals feel confident that their personal information is safe, they are more likely to be open and honest with their care workers, which is essential for providing effective care. This openness allows for better understanding and more personalized care plans. Please can you like and subscribe to our Myra Fora Giorgio's channel. Thanks for watching.